Do you have a hard time staying asleep because your body just wants to wake you up every couple of hours or maybe even every hour to run to the restroom to urinate? Well, if so, please watch this video. I'm Dr. Val, an integrative sleep medicine physician and women's sleep expert, here to talk about Nocturia, or nighttime awakenings to urinate. It actually happens pretty frequently depending on how old you are. Sometimes we think about it because as you get older, you have more medical conditions that can contribute to making you wake up at night. What are those medical conditions? One of the biggest ones is diabetes that's not controlled, because what happens when you have too much blood sugar in your system, your body wants to get rid of it. And how do we get rid of things? Well, we either poop them out or pee it out. And so waking up frequently could be a sign of diabetes. And so that's something actually that's pretty easy to get checked out. You can go to your doctor or your healthcare professional and have them do a blood test to see if that's the case for you. Another reason for people to wake up pretty frequently to use a restroom, and if you're a woman, you can actually have physical issues with your bladder. As we get older, unfortunately, our bladder isn't as strong as it was when we were younger. And so you can go and see a urologist where they can do different bladder studies to see if you're completely emptying, maybe the muscles aren't squeezing all the urine out. And so you have that sensation where you feel like you need to go constantly. And then, as we get older, especially as we go through perimenopause and menopause, we aren't as deep sleepers in and of ourselves. And so we have that sensation that constantly wakes us up. Another thing that can happen is you're on medications that make you urinate at night. And so that's something to be really mindful of. And for some people that I talk to in my practice, they wake up 2 to 3 times a night, but they're used to it because it's been happening so long, but also they can fall back asleep. The ones that get really bothered by it are the ones who can't fall back asleep. And some of those are my insomnia patients. And one good question I try to tease out, and sometimes it can be hard to tell, is are you waking up because your bladder is full? Or do you wake up and then since you're awake, you might as well urinate? And some of the research actually shows for those who have insomnia, we treat the insomnia through different techniques like cognitive behavioral therapy. And the women actually are going maybe into a deeper stage of sleep, but actually wake up less to urinate at night. Pretty cool, huh? Another thing that I see very regularly, since I'm a medical sleep doctor, I treat obstructive sleep apnea. And obstructive sleep apnea can actually cause you to wake up several times a night. If it's more than 2, it's actually concerning. I've had some people have to wake up every hour to use a restroom. After we diagnose and treat their sleep apnea, it goes away, or maybe it's a lot less. Well, what is happening with that? Well, the way obstructive sleep apnea can cause you to wake up to urinate at night is because excess pressure in your system. So the analogy I like to use is, what happens when there's too much pressure in the pipes where you live at home? Well, you got to open the faucet, open the spigot, release that pressure to allow it to go through. So with obstructive sleep apnea, it's a physical blockage of the upper airway. Typically, it's the tongue that falls down and closes off the airway. When that happens, your lungs are taking a deeper breath in. More pressure in the lungs puts more pressure in the heart. It's within the same cavity. The heart will stretch and actually signal down to tell your kidneys to wake you up to urinate. Pretty annoying, yes. But at the end of the day, if you do get your obstructive sleep apnea treated, guess what? The urinating can improve. And keep it in mind, right? I mentioned other conditions that can cause you to wake up to urinate. Another big one is just drinking too much water too late in the evening, or eating really salty foods that make you really thirsty to make you wake up and drink water and have to urinate. Obstructive sleep apnea is just one of them, but yeah, go ahead and talk to your healthcare professional if you have concerns for waking up in the middle of the night, and if you have a hard time going back to sleep, maybe look into something called cognitive behavioral therapy or different relaxation techniques to help relax your brain and be able to fall back asleep again. I hope you found this video helpful. Please subscribe for more women's health sleep topics. Thanks. Bye-bye.